Welcome to Family Basics 101. I'm Dr. Bruce McClure, and as we continue our five-part series entitled The Language of Mental Health, today we will talk about the mental health illness of schizophrenia. Schizophrenia, just the mere word, means split mind or to split mentally. It's not talking about the old phraseology of split personalities, but it's talking about the splitting or the splendoring of the mental comprehension and the mental assimilation of thinking. According to the National Institute of Health, from which most of my resource material was collected, schizophrenia is a severe brain disorder that actually impacts only 1% of the total population. Now, people with schizophrenia, however, may hear voices that others can't hear. They may see those things that others do not see. They may be fearful about others listening in or others talking about them, when in fact it is going on internally inside of the individual rather than in the reality of what people are actually doing toward or against them. It is not uncommon for a schizophrenic individual to sit for hours without speaking or without interacting with the outside world because they are actually engaged and being engaged by their inner world on a more internalized basis that the outside world really does not understand. When a schizophrenic person speaks, oftentimes the conversation seems disconnected really from the reality of the individuals to whom they are speaking. Schizophrenia is a difficult and is very difficult to determine in younger children. But by the time the child is typically ages 16 to early adulthood of 30, the delusional behaviors become more clearly manifested. During the earlier stages before 16, typically you'll see potentially a drop in the grades, changing of friends, difficulty sleeping, easy agitation in most children. So if there's something else going on mentally, it is masked because people will attribute it simply to the childhood developing, transitioning from early childhood into puberty and young adulthood. So it's masked in its diagnosis younger. But there are three primary indicators that should be monitored if the behavior in children or early adulthood seems to be different. If this child is constantly isolating themselves from social settings, or if there's a continual increase in their suspicion about others and it's escalating, and they have these abnormally unusual thoughts that are not really connected to the reality of the world that you as the primary or secondary care provider knows, or if there's a family history of psychosis, then it may necessitate monitoring even that 16 or 15 or 14-year-old a little bit more closely. Although the majority of individuals suffering with schizophrenia aren't violent, some of their delusional thinking and their fears of being persecuted by others may cause them to act violent in their outbursts and sometimes their behaviors at times. But as a whole, schizophrenic individuals are not known to be very violent-prone people. Suicide, however, is at a much higher rate among individuals who are schizophrenic. Addictive to cigarette smoking is about 3 times higher than in the general population among individuals who suffer from schizophrenia. In fact, it's as high as 75 to 90% of the schizophrenic population, whereas in the general population, it's only about 25 to 30%. Smoking has been found, according to the research, to make the effect of the antipsychotic drugs much less effective in those who suffer from schizophrenia. The symptoms of schizophrenia are generally put into 3 categories. Those are positive, negative, and cognitive. In the positive arena, individuals may lose touch with reality and then reconnect with reality. They may suffer from hallucinations, be delusional, they have thought disorders, and they have movement disorders. In terms of the negative symptoms, these are disruptions to normal daily functions. They have a flat effect. They just stare. They really look like they're in a completely different zone. There's the inability to enjoy pleasure, the inability to plan or to implement or to sustain the events of one's day. Speaking very little, even if they're forced to interact with others, there's really a reluctancy or a non-desire to even talk. In terms of the cognitive symptoms, these symptoms are quite subtle and are determined through psychiatric testing for the most part. The cognitive looks at the execution function, which are the abilities to understand and make decisions. One, abilities to focus or pay attention, and then the working memory, the ability to use information immediately after it is learned. So the cognitive function or the cognitive symptoms typically must be determined, and only through testing for the most part. Although schizophrenia only occurs, as I stated earlier, in only about 1% of the general population, it is found in about 10% of families where the primary relative, meaning the parent or another sibling, had the illness, or if the secondary relatives, which is an aunt or an uncle or a grandparent, has the symptoms. So 1% of the general population, but in families where it's more prevalent, about 10%. The neurotransmitters dopamine and glutamate that are responsible for the brain communicating with itself are misfiring, and it's really causing the schizophrenic condition. Research is also finding that things such as malnutrition, prenatal, viruses, and complications during birth may also contribute to schizophrenia. Now, the older antipsychotic medications that were used to treat schizophrenia, and sometimes still are today, are Thorazine, Haldol, Trilofan, and Prolexin. But the newer antipsychotic medications are risperidone or Risperdal, Zyprexa, Seroquel, and the more noted one, Abilify. In the Bible, in the book of Daniel, chapter 4, verses 28 through 37, it contains a story of a Babylonian king, Nebuchadnezzar, who was delusional, could not utilize information properly, was easily agitated, possessed poor social skills, which ultimately led him to being driven away from his own kingdom. Later, his reasoning abilities will return, but later the same traits are going to be manifested in his son, Belshazzar. Schizophrenia. It's a splitting of the mental abilities. I'll see you back in class again next time. Don't be late and don't skip class.